All right, so this is gonna be my week 6 fundamentals video. This is gonna be over Meded Men. So I'm administering 7 units of insulin, so Humalog, and then I'm gonna give 325 milligrams of Tylenol. And I don't have a pill, but I'm gonna use this pen for my sub-Q injection. So starting off, I'm just gonna say that when I start, so I'm gonna start in the med room. Like, I'm not gonna be at my patient's bedside just yet. So I'm starting in the med room. So what I'm going to do is I'm gonna just pull up my medication. So I have my MAR with me on the computer, and I'm gonna pull that up. I'm gonna just make sure that I have the right patient. So I'm gonna check that out first and just make sure that I'm in the right patient's MAR. And then I'm gonna pull that patient up on the Pyxis or Omnicell, whatever you have. And then I'm just gonna verify that I'm looking at the same patient on each. So then next, after that, I'm gonna start pulling out medications. And when I do, I'm gonna do my, my 6 right. So I've already verified that it's the right patient. I'm gonna do the right drug, the right dose, the right time, and then right documentation will kind of come later, but that one is still in there. So that's my first check, is when you're pulling meds out of the Omnicell or Pyxis. So after I do that, and then I'm kind of in my head too, not in my head, but I'm also looking, so you should always be verifying allergies. So whether you do that in the room at the bedside, or you do it at the start of your shift, or you do that while you're pulling out the medication. So just making sure that you're not pulling out a med that they're, you know, allergic to, which that shouldn't happen, but very well could. So just making sure that you're not, you're going over those, and then looking for those like contraindications. Like, if I'm giving one med, I need to make sure that it's not going to interact with the other med. And like I said, that stuff should be caught, but you never know. So after I pull out all my meds, so for my insulin, I'm going to draw this up in the med room because it's a multi-dose. So what I'm going to do is, so I already pulled out my Tylenol and my whatever other meds. So I have my multi-dose vial, which I don't have anything to like, just pretend I have a vial. So what I'm gonna do is I'm gonna go ahead and just look at my order again. When you're drawing up meds, this should be, sorry, this should be your second check when you're actually like drawing up a med. So I have my vial with me, and I'm gonna just compare what I'm actually drawing up. So I'm gonna, you know, scrub my top off when I pop the cap off. I'm gonna pull back my air, I'm gonna inject the air, and then I'm gonna draw back my mils. And then when I have this drawn up, I just wanna check again and make sure. So my 7 units, I checked it before I drew it up, and I'm checking it again just to make sure. And then you want to, so with insulin especially, you wanna have someone else verify. So you can, you know, call in another nurse. I like to do it in the moment just so they can see, you know, I like, obviously, because who knows what that could be. If you don't like, you know, if you have another nurse in there, like, hey, I'm gonna draw this up really quick and you can verify, I think it's better when you actually see them draw it up. Because then you don't think that, you know, like they could be, anything could be in that syringe that you're showing them. So if you're just doing it in the moment, I think that's better. So then after that, I'm going to, since I'm not in the room, well, I'm gonna label my syringe with the patient's, you know, like initials, and then I think it's just the initials, and then maybe like what it is. I don't know. I don't know how you would label that, because I don't think there's enough room on the syringe. I think it's just the initials that you need. So then I'm gonna recap my needle, and since it's a clean needle, you can, and what you're gonna do, I don't know if I can show this. I'm gonna try. Okay, so let's say this is my needle here, and then this is my cap. So I'm gonna do like a one-handed kind of thing. And so I'm just gonna kind of scoop it up in there and then put it back on, basically. Probably not, I mean, you just kind of like scoop it up and then, but it's not as long, it's, you know what I mean, one-handed scoop. So, after I did my, after you do your one-handed scoop, so you're ready to you're ready to do your, I'm sorry, I lost my train of thought. You're ready to go into the room. And I don't know if I said this, but I think I did. But before you're drawing up your meds, you're doing your second check. So I think I said that, but I don't think I said. So you're going to check right patient, right drug, right dose, right route, right time, and then right documentation. So you're checking that when you're drawing that up. So I think I said to check it, but I don't think I said explain each one of them. So, okay, so I'm going to walk into my patient's room with my 325 milligrams of Tylenol, and I've got my syringe that's labeled that I'm getting ready to administer. So when I come in, I'm just going to knock on my patient's door, provide privacy behind me. I'm going to, introduce myself, let them know what I'm about to do, like, hey, I've got some meds for you. And then I'm going to identify my patient. So I'm going to ask them her name and their birthday and just match it with their ID band. I'm going to pull up my MAR with me. So I have that because I'm going to start looking at that in just a moment. And then I am going to, I know that whether you verify allergies in the med room or at the bedside, I don't think it matters. As long as you're verifying them. Sometimes it's nice to like ask your patient, like, what are you allergic to? Because what's in our system, I want to make sure that you know what you're allergic to. And most patients do know that. So sometimes I think either way is acceptable. So after that, I'm just going to do like my assessment. If I need to get vitals or anything, if I'm giving a blood pressure med, then I definitely need to get some vitals. So after that, so like if I'm going to give my insulin, then I would need to have my blood sugar machine, or it's already been checked by either myself or the tech that you're working with, or, so you want to make sure you have that number, because if not, then it's probably not beneficial to be giving insulin. You also want to make sure that the patient has food in front of them, or it's like literally on the floor about to be delivered. So you're going to start with, so before we even start, you're going to check your meds again. So this is your third check right when you're at the bedside. So you're going to check right patient, right drug, right dose, right route, right time, and then right documentation will come, once you scan it and then accept it, it will do your like documentation thing. But that's your third and final check before you're administering, and your syringe is already drawn up. So what you're going to do is, and I don't think I said this either, but when you're scanning in meds, do like your education with your patient, make sure it's okay to give the injection. I like to ask which site they want to do. If they, self-administer insulin, then you can have them do that, because why not? And you just want to give them time to ask any questions. And if there is anything you need to look up, then you have those resources available. But you really should know what it is. But there are some meds that I don't even know, honestly. Even when I look them up, I'm like, I had no idea that's what it was for. Let's see. Sorry, I forgot what I was saying. Anyway, so I did my checks. I did my education, asked any questions, so I start to scan in my meds. So I'm going to scan in my insulin first, because I'm going to work clean to dirty, so I'm going to do my sub-Q injection first. So what I am going to do is I am going to so I'm going to stand and do this, and I'm going to just like use my belly to show you this, because I feel like, I guess I could use the back of my arm. I just feel like it's so hard to do the back of my arm. So I'm just going to use my belly here. Okay, so what I'm going to do is I'm going to just lift up my patient's gown. Let's say I have an alcohol wipe in my hand. So I'm just gonna like alcohol, off, and I'm gonna do it in like a circular kind of motion, so you're like wicking away all of that, if that makes sense. So then, obviously I have uncapped my needle, so that's uncapped. I'm gonna set that down. And then if my safety, so sometimes safeties are like this, I would kind of push that back so that's not getting in my way. So what I'm gonna do is I alcoholed, I'm gonna do my non-dominant hand, and I'm gonna kind of squeeze. Oh, also I wanna make sure that I'm going at least an inch away from the belly button. So I'm just gonna kind of squeeze with my non-dominant hand, sorry. And then I'm gonna inject either 45 or 90 degrees, depending on how much sub-Q fat that person has. So I'm going to inject, I'm gonna release with this hand, let's say this is my plunger, so I'm gonna slowly inject that med in. So then after, I'm going to I'm gonna take out my needle in the same angle that I put it in. So I have just released it. So with insulin, you want to do your safety. So either you pull up, so if your safety is here, then you would want to take your needle on like a hard surface. So like if your safety's here and this is your hard surface, you want to put your safety. So my needle is capped, and then put that in the sharps container, and then you would, wherever your injection was, you would want to put like a piece of gauze. And sometimes you could put a Band-Aid there. I mean, if it's insulin, they're probably not going to bleed. But if they do need something like gauze or a Band-Aid, then definitely put that there. So then you want to make sure, I don't think I said this, but make sure your needle goes in the sharps container, because that's where it should go, not in the trash. And just make sure that that goes, well, that's off topic, never mind. So just make sure that that goes in the sharps container. Afterward, just make sure that, pull the patient's gown back down, whatever. So, and I've already scanned that in, so once I administer it, then I can click accept for my like documentation part. So next, I'm doing my Tylenol, so my 325 of Tylenol. So let's say I have that in a package and I don't have a Tylenol, I forgot to bring one, sorry. So let's pretend this is in my Tylenol little package. I'm again doing my third check for this med too. So right patient, right drug, right dose, right route, right time, and then my right documentation will come. And then, so I'm gonna scan the med in, let them know, hey, I'm giving you 325 of Tylenol. If you're doing it for pain or for fever, make sure that you have that documented. So if it is for fever, make sure you have that fever documented. Pain, make sure that your pain scale is documented like in the chart so they can see that and you can associate that with the why you gave that medicine. And then, so I just scanned it and I'm not gonna hit document until I watch this patient take the med. So let's say it's in a package, I'm just gonna pop this into my little medicine cup here. And then prior to giving any meds, I wanna make sure that my patient can swallow. And then I wanna make sure that they're sitting up at a comfortable angle. So I know the checkoff sheet says like 30 degrees, but that's really low to me. I don't think I could even swallow at 30 degrees. I usually ask my patients what they're comfortable like swallowing at. If you have like a young patient that's like, I'm in pain, I don't wanna sit up. Sometimes I'm like, what is a comfortable spot for you to swallow that your pain isn't tremendous, If they're on aspiration precautions, obviously they need to be, you're probably not giving them whole meds, you're probably like crushing them, but if you are giving them whole meds or you're crushing them, they need to be up like 90 degrees. So I give my patient their meds, or their med, I'm sorry. So and then I just want to make sure that they, watch them take it. Don't like turn around and, I'm not saying like stare them down, but just like see them, watch them take it, swallow it. Most patients will just like, take it down, whatever. And then you can ask them, like if it's a patient that you're unsure if they actually swallowed it, then you can ask them, like, oh, let me just make sure. I've asked that a couple times with like my confused patients because sometimes I think that they, you ask them like, did you swallow it? And they're like, yeah. And then they're like talking and the meds are like, you can see them in their mouth. So sometimes I think they just like confuse patients, So I don't really think it's necessary to like look in everyone's mouth, but just making sure that they swallowed it. But if you're watching your patient, I think you can kind of know when they swallow it and when they don't swallow it, especially because pills are pretty gross. And then after they swallow it and they took it, I'm going to go ahead and hit accept on my documentation, and that's going to flow in there. And then after that, and I don't even think I said this. So self-identified break. I didn't say at all when to do hand hygiene. Obviously, you're probably going to have gloves on when you're doing your sub-Q injection. So you're going to be doing hand hygiene. You're going to remove your gloves, after you give the injection, and then do your hand hygiene, put new gloves on, and when you give the med, remove gloves, and do your hand hygiene. And I'm sorry, I didn't say that, but it just slipped my mind. So obviously, do your hand hygiene. And then after that, you know, just making sure that your, just check and make sure that your documentation is saved, that you did accept it and that it is in there. Making sure that your patient doesn't need anything else. Make sure that their bed is in the lowest position, it's locked, it's at a comfortable setting for them. That our chair alarm is on, that their belongings are in reach, call light is within reach, and just making sure that they don't need anything before you leave the room. And then you're gonna do your hand hygiene on your way out. All right, so I'm gonna use my self-identified break because I forgot to say a couple things. Before I do my sub-Q injection, I'm checking the abdomen for any lesions or any trauma or inflammation or like bony prominences. I'm doing, you know, a skin assessment when I'm, you know, lifting the patient's gown up. I'm looking for all of those things. So if there was something, I don't know, if there was a lesion on the left lower quadrant of the abdomen, I'm not going to do an injection right there. Same with like a bunch of redness, inflammation, I'm not going to do my injection there. And then I also forgot to say that after my injection, so prior to putting on my Band-Aid, I think I said something about, like, you know, if sometimes they're not bleeding, especially if it's insulin, but before putting on the Band-Aid, you would want to check for any bleeding, any, like, a lot of redness. I mean, a little bit of redness I think is expected because you're sticking a needle in someone's skin. But if they have like a lot of redness, that would be an issue. And then you're just checking for like a reaction. So you would want to note all of those things. More than likely, if you're doing your sub-Q injection first and then you're giving your oral meds, you should probably check that before you like leave the room just to make sure. So then for my documentation part, so I kind of like integrated this into my stuff just because I feel like when, especially in the hospital, you're documenting right as soon as you give the med. It's not like you're walking out of the room and you're going to sit down and be like, okay, I'm going to document my meds now. Like, no, that's not how it works. But when you are documenting, so you're doing kind of like you're doing your checks again. You want to make sure that you're in the right patient's chart, that you have the right drug, like the name of the drug, that it's the right one. You're documenting the right dose, the right route, and the right time. I keep saying route, right? Route, I'm sorry, and right time. And then you also want to make sure that you're documenting like if you performed any assessments. So if you did vitals, which those should already be documented. If you're giving meds and you're already have the computer up and you did vitals, I mean, you should be doing that before you give meds because most likely that whatever you're taking is probably beneficial to what you're giving. So if you're taking, you know, a blood, you know, you're taking a blood pressure, you're not going to give the med and then be like, oh yeah, the blood pressure was this, and this. Like you're gonna document that before you give the med. But anyways, if the like the patient's like outcome and response, you want to document that as well. If you did any teaching, which most nurses, when you give meds, you tell them what it's for. So I feel like nurses do teaching all the time and they just don't realize that they do it. And I feel like a lot of people don't document it. So any teaching that was performed, you want to document that. If you withheld any meds, which you shouldn't be withholding meds unless the patient refuses or unless you have an order. So let's say, I know specifically with like blood pressure, sometimes the order will say like hold if systolic less than 160. So if you did withhold that medication, you would put that in the chart, and then there's like a little comment box, and I usually write a comment, and then I will like attach the blood pressure with it. So let's say the blood pressure was like 120 over 74. I'll put in the comment like, blood pressure was blah, 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 and order was to hold less than 160. Just so when someone looks back on that, I want them to know that like that blood pressure was there, I took that blood pressure. I want them to know that. If a patient refuses, that is their right to refuse. Usually there's an education piece with that, just because obviously most of those meds, they need those meds. So it's important to educate, and then just notify your physician. So document refused, and then just let the physician know like, hey, so-and-so refused, I don't know, Lovenox injection today, did education, but maybe you want to order some SCDs because they're refusing their Lovenox. I don't know, just something like that. So just making sure that you're documenting in the moment with your meds. I mean, I know, yeah, just documenting right there with all your meds, and just making sure that you have the associated like data with the meds that you do need. So insulin, you just want to make sure that you have the associated blood glucose, and then Tylenol, if you know, that could be for fever or for pain, just making sure that those are documented too. And I think that's it.